Hi, I am Dr. Hemanth Kumar Pandharpurkar. I am a consultant vascular and endovascular surgeon at Manipal Hospitals, Bangalore. I will briefly speak about gangrene of the toes. Now, gangrene is a dangerous word. The gangrene means death of tissues. It is one of the commonest causes for OPD consultation in vascular surgical practice. Gangrene can be of two types. It can be a dry gangrene or wet gangrene. In patients who are diabetic, who are smokers, the blood supply to the feet can get blocked, and that leads to dark discoloration and death of the tissues in the toes, especially the toes. We see it as a black dry toe or a patch of black skin. It is usually painful. Usually it is not swollen or there is not much of pus, though it may be a bit smelly. So this happens primarily because the blood supply to the legs is cut off. It could be at anywhere from the heart till the foot. The treatment for this type of gangrene is not just to amputate the toe, but first to re-establish blood supply to the foot. That is usually done after due evaluation in the form of an CT angiography or a conventional angiography and a revascularization procedure in the form of a balloon angioplasty of the occluded blood vessels in the legs or the thighs, with or without a stenting. Basically, a wire is passed across the occluded blood vessel over which a balloon is passed, and the balloon is inflated to open up the artery which is narrowed, and the balloon and the wire are taken out and blood starts to flow down the occluded segment. This is balloon angioplasty. Sometimes after opening up with the balloon, the artery tends to get occluded again. In such cases, we put a metallic scaffold like a tube inside the artery to keep the artery open, and that is called stenting. Some patients have long segment blocks, long length of blocks, which may not be suitable for balloon angioplasty or stenting. Such patients benefit from undergoing a surgical bypass grafting to bypass the occluded segment of the artery using the patient's own vein or synthetic vascular grafts so as to establish blood supply to the foot. So once blood supply is been re-established, then we amputate the gangrenous segment, gangrenous toes, and then we can be sure of the healing. Without revascularization, just amputating the toe will only worsen the wound, worsen the condition of the foot, and eventually lead to foot loss, leading to a major amputation. The other type of gangrene is wet gangrene. It usually happens in diabetic patients whose sugars are not under control and who are not taking care of the foot. A small ulcer in the foot becomes the source of entry of a serious infection, and within a few hours to days, the whole wound and the foot becomes necrotic or rotten because of spreading infection. Here, even though the blood supply may be good, the infection is so severe that the tissues die, and eventually the patients come to the emergency to the hospital and end up requiring amputation of the gangrenous toes. It is essential that any diabetic patient with suspected wound in the foot or an ulcer consult a vascular surgeon to not only save his limb but also his life.